First at 5, tomorrow, hundreds of union nurses at Kapiolani Medical Center for Women and Children won't be at work. Instead, they'll be on the picket line. But as Eddie Dowd reports, the hospital says operations will not be affected.
The hospital tells me they plan to bring hundreds of travel nurses from the continental U.S. here to the hospital to help continue operations so that they're not disrupted by the more than 600 nurses planning to go on strike on Sunday.
Test.
Nurses from Kapiolani Medical Center for Women and Children are spending their Saturday putting together signs and getting shirts ready to be worn on the picket line while on strike. Some never think it would actually come to this.
Yeah, so many emotions. I've been a nurse for 31 years, and this is the first strike that I've ever participated in or worked at a place that had a strike. So it was very hard to leave work yesterday.
Union officials say they still plan to strike for a week, but that could be extended. The president of the Hawaii Nurses Association, a nurse herself at the hospital, says it's not just the loss of income that's challenging.
The hardest thing is to not be able to take care of the patients when they need you. So I know that it's going to be hard for a lot of us out there.
But the hospital says it did not have to be this way, saying it's the union that continued to press for more at the negotiating table. The union says the issue now is not over money, but about how many patients are assigned to one nurse. They argue that during COVID, being overwhelmed with patients became normal, but should not continue now.
We don't want to be there every day for 16 hours. We need to get back to a normalcy and where the nurses will stay, because nurses are leaving by the droves.
Something the hospital is pushing back on.
75% of our nurses have been with us over 5 years.
The hospital also says the ratio requirement the union wants could impact their ability to provide care.
The difference is flexibility, and I'll give you an example. When a patient is here in the medical center and they need to go to a higher level of care or they need to move to a different location, we need to be able to move that patient while we are bringing another nurse in. A hard ratio means we have to wait until the nurse gets there before we can move the patient. That could be a delay in care.
Hospital officials say they are determined to continue to provide the same quality care while the strike goes on.
The workforce that we have secured from the mainland is well prepared. They are experts in their field and they are ready to go.
Hospital officials declined to comment on just how much money they were spending on the travel nurses, but did say the next meeting with union officials is scheduled for January 31st. Eddie Dowd, Hawaii News Now.